Good morning, everyone. I'm Emily Borman-Shope. I'm our Vice Chair for Education here in the department. I realize I am remiss in not having the kinds of details that we usually would use to introduce our Grand Round speaker, but I hope you all will recognize his face, and I'll just take a moment to thank him for his exceptional leadership during challenging times. We're returning to our somewhat usual programming for Grand Rounds today with our State of the Department. So without further ado, I'll turn it over to Dr. Neglia.
Great, thanks, Emily. So I am not as comfortable with technology as Dr. Borman-Shope is, but I am going to share my screen and put this into slideshow mode, I hope. And Emily, does that look right?
Yeah, looks great.
Amazing. All right, so thank you everyone for being here for Grand Rounds. And I would especially like to welcome all of the staff of the department. Rob sent a note around to everybody yesterday asking them to join. Usually we do a State of the Department Grand Rounds for the staff as well a couple weeks after this, but with the current craziness, we are going to miss that, so they've been invited to join this Grand Round. So welcome and thank you for joining us. If everybody who is not on can mute, that would be good too. So just to get some of the housekeeping out of the way, my name is Joe Neglia. I'm the department head. I would guess a lot of the students, so a lot of the other individuals that are part of this do not know me. I've been in this role since 2011 and feel very fortunate to be able to be department head for a department as outstanding as this. I have no relevant financial relationships. We're not going to talk about off-label use of drugs or anything like that here. First thing I want to do is just take a minute and thank you to the individuals who helped put this together and really who contributed so much over the last year. You know, certainly Ann Bloomer, Lamont and Milan Anderson, and my assistant who does an incredible amount of work at all hours of the day to keep the wheels on the bus here. Christy Flanagan, Villar, and Elizabeth Patty, who've done an incredible job of fundraising for this department. Doctors Borman-Shope, Emily Gray, Amy Gao in education, Doctors Moran and Bendel for our diversity and development work, Ron Furnival, Sam Gupta, Brandon Nathan, who've all contributed to the clinical part of this, and then Lori Wallen, Angela Paniskaltis Mortari, which I realize I just spelled wrong, and Michael Georgia for their work in helping put the research side of this together. So anyway, thank you to everybody being involved. The agenda for the meeting today is pretty straightforward. We're going to talk about our 2019 highlights. We're going to go through this by mission. And at the end, talk a little bit about, highlight a faculty member whose work is really changing the practice of medicine. But beyond that, I want to talk about a real goal today that I'd like us to keep in mind, especially given the COVID crisis and all the changes that have been made really in the last 4 weeks in our practice, our laboratories, our education, everywhere. And that's keeping your eyes up and looking further down the road. So I'm sure a bunch of people just broke out laughing, but this is one of my avocations, and when I'm in summer and it's nice, I try to get out on the racetracks and not hurt myself and have some fun. One of the things I learned in taking up this sport years ago is the importance of looking beyond what's immediately in front of you. You have to be aware of that, but it's hugely important to keep your eyes up, keep the distant horizon in check so you know where you're going. And that's what I want everybody to try and think about a little bit this morning as we work through this past year and then start to think about our next year together. So keep your eyes up, look at where we want to go. Let's not look at all the potholes all the time. Got to miss them, but you can't just stare at them. So 2019 was a very, very busy year. You'll see that in the next few slides. These were our arrivals in 2019. I'm not going to read all these names because there are 24 on this slide, there are 9 on the next slide, and there are another 20 on the slide that come after that. But we had a lot of new arrivals into the department. We've been able to continue to grow the department in a very nice way. We've had new arrivals in genetics, emergency medicine, neonatology, HEMOC, clinical behavioral neurosciences, epidemiology, cardiology. Almost all of our divisions grew in this past year. We had some losses as well to the department. A number of people moved on to other positions. Mark Roback, who most of us know pretty well, Mark was a medical student here ages ago, came back with Ron Furnival to actually build and lead the ED department, has now moved on to head the emergency program at the University of Colorado. Priya Verghese moved on to head the nephrology program at Lurie Children's Hospital in Chicago. So people have moved on. They've moved on to some excellent positions, and we wish them all the best. So we did have 9 departures in 2019 against those 24 hires. And then this is where we're at in yeah, that's what happens to me too. I choke up. This is what happens in 2020. These are people that have already signed. They are going to be arriving through June, July, through July, August, maybe some of them into September. But again, we are continuing to grow. You'll notice a few important names on this list. They're all important names, but a few important things. We have been able to really rebuild the genetics division. Anjali Agarwal joined us last year. This year, Charles Billington will be arriving from Children's National and the NIH. Bill Dobbins will be coming from the University of Seattle in Seattle, Washington. And Nishita Pillai will be coming from Texas Children's Hospital. We will actually be building out both the research side and the clinical side of our genetics division. Damien Fair is joining us. Damien will come as a professor jointly appointed in the College of Education and Human Development and in the medical school in pediatrics. He and Michael Georgieff will be leading the Institute for Child and Adolescent Brain Health, which you'll hear about later. We've added some great MD PhDs from our own program. Dr. Dan Beising will join us. Dan is a pulmonologist. Beth Thielen will be coming on into the infectious disease division. Beth is a Med Peds graduate of the program. We have hired a new palliative medicine director, and that will be Lan Nguyen, who will be joining us as well. So total of 44 arrivals coming between 2019 and 2020. Department is definitely continuing to build. We've had a number of important events. Philanthropy has been a huge piece of what makes this department work. And this is just a highlight of a few of them. And we have amazing donors. One of our more amazing donors is the Blythe Brendan Mann Foundation, which is directed by Blythe Brendan. She's donated $2 million to help develop the Institute for Child and Adolescent Brain Health. Frank and Katina Gujan have been long supporters of our cardiology program. They have actually donated $1 million for adoptive room equipment and to enhance the adoptive rooms here across the hospital. Another $1 million from Northwest Mutual for the Pediatric Cancer Fund. The Otto Bremer Trust, $1 million donation for the Institute of Child and Adolescent Brain Health. As always, a huge contribution from the Children's Cancer Research Fund. And a new contribution this year from 3M on the 3M Open, which you'll see a picture of a little later on, but $600,000 this last year for our programs at the Children's Hospital. So really, we've had a great great success in philanthropy, and it's very exciting to all of us. Our space, the Brendan Mann Wellness Center up on the 5th floor, in 2019, 139 hair appointments for our patients, 190 nail appointments, and over 150 massages. So our patients are making great use of this space. The Cal Rudolph End Zone down on the 1st floor near the Wolf Center, over 11,000 visits since its opening in 2018. Family Resource Center sees about 85 people a day, and the Wolf Center is a tremendous value to us. Over 5,000 event hours booked and over 39,000 in attendance. So really the space has been just great. As I mentioned, we have a number of corporate sponsors now. 3M is joined in, all the way from restaurants, Caribou Coffee, hotels, KLN family brands. You'll hear a little bit about that later. The Twins, the Vikings, the Minnesota Wild. It is a very big job to keep this whole thing moving along. And I really want to thank Elizabeth, Christie, and everybody at the University of Minnesota Foundation for their work in allowing this to happen. This is just celebrating the opening of the 3M Open Plaza. This was last fall. This is again part of a 5-year commitment with the 3M Open, and we're very excited to have us be their primary charity for these years of this golf event. Fox 9 News has been very engaged, and this is an episode that they broadcasted from the End Zone Center. But this past Christmas season, they celebrated 12 days of giving with crowdfunding campaigns. Each day featured stories and interviews about our patients and about our care, our research, brain health, the Heart Center, highlighting the Thielen Foundation, highlighting our nursing staff. All in all, a great gift to us, really a true gift to us from Fox 9. The other a nice gift, the other new person on the faculty this year is Rocket. Rocket is obviously a golden retriever that has been specially trained as a therapy dog. KLN Brands made a major gift in support of bringing this dog here. These dogs are very expensive to train and to support. Rocket got a nice startup package through Fashion Fest this year, and he's been busy making patient visits. It's been a real gift to have this opportunity for our patients. WineFest, you know, every year is our major fundraiser. This year is WineFest number 25. It was supposed to happen in May. At this time, we have rescheduled it for July, the end of July, and hopefully this will come off and we'll be able to celebrate WineFest number 25. This really provides a huge amount of support for the Department of Pediatrics. Helps fund new research, help fund new educational initiatives. It's a very big deal, and I encourage you all to get to these events. The Friday night event is usually a lower key event, a lot of fun. Saturday night is a large dinner event. If you can make those, it's great to get there. It's fantastic for all of us. So we're going to go through the mission updates and start with education. Education certainly is very much core to what we are doing. So we'll start with the students. Our medical school clerkship remains one of the highest rated in the medical school. Students like working in pediatrics. They get good teaching. We are working to do more than just the standard, the expected. Last year, we had a successful burst mentoring program. This is really a small commitment with hopefully big return. Faculty that participate in this will do 3 mentoring sessions, 30 minutes each with the student once a month, offer them 1 shadowing opportunity, and really just get them exposed to what we do in the Department of Pediatrics and what life could be like as a pediatrician or an academic pediatrician. I'd encourage people who are interested to please see if you can take on a student in this program. Our residency continues to do well. You can see we've hit our peak last year of over 1,100 applicants. Had a little bit of a downturn this year to 1,124. That's probably good news. One of the concerns we've had in pediatrics is the number of people that are applying to 20 and 30 programs, knowing that they probably really don't want to go to a whole bunch of them, but it really creates a, can you imagine the group trying to sort this 1,100 people down to 180 who are going to be interviewed. So we're very happy with our class selection this year. These are our incoming interns. It's a great representation from universities around the United States as well as around the world. We have Illinois, Wisconsin, South Carolina, Indiana, Nigeria, Chicago, Boston. We even have Kayla, who I'll have to meet, who went to medical school where I went to medical school a long time ago. I don't know that I'd recognize it anymore. But really a great class, and thank you to everybody that participated in our intern interview selection and intern selection committee. Our incoming pediatric and medicine pediatric residents continue to be a very strong addition to our program. Again, this is a nationally recognized program in medicine pediatrics, as you can see from the wide range of applicants, from wide range of selectees from across the country. A combination of this program, our categorical pediatric residency program, and then our international immigrant medical graduate program and our primary care expansion program all allow us to bring in somewhere around 36 new pediatricians or medicine pediatrics residents each year. It's a very big commitment that has really had a very good return for the department and for the state of Minnesota. The pediatric residency has worked very hard under Dr. Borman-Shope's leadership and others to build in mental health education and training into the residency. And here you see Drs. Borman-Shope and Barnes discussing this, but minding the mental health gap in Minnesota was highlighted by the American Board of Pediatrics this year, recognizing us for our work in interdisciplinary and interprofessional collaborative office research rounds and conference. So how do we actually teach our residents to care for mental health issues in kids? And how do we actually teach our residents the best way to interact across disciplines to do this as efficiently as we can? So this started up and actually became a grant application to the new academic investment programs, and it was awarded one of the academic investment education program grants for over $550,000. And we're very excited about this work that we're going to be doing with the departments of psychiatry, nursing, and family medicine to again try and build up our capacity across the state to take care of children with mental health concerns. We continue, as I mentioned, we continue to have our primary care expansion grant funded. This allows us to take an additional slot, someone who is interested in working in primary care, and then our international immigrant physician grant program, allowing a graduate of a medical school, probably a practicing physician in another country who left that country under the strains of whatever may be going on in that location, to come to the U.S., an opportunity to actually do a pediatric residency, become licensed in the state of Minnesota, and then give back through service in an underrepresented community here to the state of Minnesota. So that program has been going on now. Both of these programs have been going on for 5 years and has raised over $2.7 million through grants. Our residents that are graduating are doing well. Typically about half to a third will go into subspecialty fellowships. This is just where people went this year. Number of people stayed here at the University of Minnesota and joined various fellowships. One of our graduates joined the Emergency Medicine Fellowship at Children's. You can see we have a number of individuals who have been accepted, a couple at Boston Children's Hospital, NICU at Tufts, NICU at Vanderbilt, the Epidemiology Investigation Service in Heidi Moline in Atlanta, Hem-Onc at St. Jude's and Emory, Pulmonary at Texas Children's, and Allergy at National Jewish. We really have outstanding residents who are trained well and are sought after for some very good fellowship positions. This year in the fellowships, we had a very good year. The Pediatric Hospital Medicine Fellowship is applying for ACGME accreditation, and that should happen on July 1st. 11 of our accredited fellowships just received commendation from the Pediatrics ACGME Review Committee for our substantial compliance with their program requirements. So this is great for our fellowships. We congratulate Doctors Tony Moran and Logan Spector on the successful recompetition of both of their T32 grants in pediatric endocrinology and epidemiology, respectively. These grants are harder and harder to obtain, and again, congratulations to Tony and Logan on this successful recompetition. Another big effort this past year, for the past several years, has been faculty development and diversity. And in this area, I really need to give credit to Doctors Tony Moran and Kathy Bendel. They're the two people that have come to work every day to help develop this. And more recently, Mike Pitt has joined that group and added his special level of insight and enthusiasm to this work. Development meetings have gone on throughout the year. There are core curriculum development meetings that are planned for the assistant and associate professors. Two of those were held prior to our shutdown, but one in October on vision. Included Yoji Shimizu from immunology, Dave Rothenberger, retired head of the surgery department, Mandy Termulin, who's our Dean of Faculty Affairs, and myself. A December collaborative meeting that involved Connie Delaney, the Dean of the School of Nursing, and Tamar Gronval from the Office of Conflict Resolution. So really trying to expose ourselves and learn from leaders and learn from people beyond our immediate program about how to move our careers along. Department Grand Rounds has been part of this. Mike Pitt did a great Grand Rounds called Say What? Again, diagnosing and treating 7 types of jargon overuse, and we all find ourselves going down that rabbit hole every now and then, trying to figure out what we're talking about. It took me years to understand that TBI meant traumatic brain injury and not total body irradiation. So it's something we all get into and have to watch. Nathan Chamilo, one of our graduates, came back, gave a Grand Rounds, diversity Grand Rounds on racism's roots in medicine and that impact on early childhood. And then most recently, James Collins came and talked about the social determinants of racial disparity in preterm birth rates. So a great program. Workshops have been held by several of the faculty, Alicia Kunin-Batson, Sarah Kisselbach, Emily Greengard, Matt Ambrose, and Emily Borman-Shope. And then finally, we have been able to arrange for leadership training. Dr. Bullock did the quality improvement course through the Intermountain Health Program in Utah. Joanna Shearer and Kiki Sarafoglu through APA and AAMC. And then even some of our not quite faculty yet, but we hope will be faculty someday, Julie Johnson-Rouse, Eric Velasquez, and Sean Mahmood through other programs. Our LEAD program is a university-wide program that we're selected to participate in this year. It's open to one school or department each year and is run out of the University Office for Human Resources, Leadership, and Talent Development. This year, we were able to select 22 assistant and associate professors as emerging leaders. They were selected by their division chiefs to represent that division, and then there were 4 additional slots that we filled. Their meetings and their curriculum really encompassed a number of topics: envisioning where you're going to go, your results, how to effectively collaborate, the important role of equity and diversity in this, creating a team, creating accountability for that team, and managing that team. These lead faculty will actually play a big role in the department's strategic planning retreat that we're planning for September. Mike Pitt is going to oversee this, but for people that have been here more than 7 or 8 years, you'll remember that in 2012 and 13, we undertook a visioning program to really create a strategic plan for us. We called it 2020 Vision at the time. Talked about where we wanted to go and what we wanted to do across the areas of education, research, clinical care, and community engagement. That document has played a pivotal role in how we've elected to use resources, the things that we have done to try and build the department, but it's time to revisit that. And we'll have the lead faculty playing a role in leading the development of the new document that really is going to be an effort across the entire faculty. These are the individuals in the program. Again, I won't read everybody's names, but this is a very talented group of young and mid-career physicians. We continue to do the peer-to-peer based development. This is Mike Pitt's effort that has just been incredibly valuable. Peer-to-peer sessions on a wide range of subjects. Picu, the peer pressure productivity efforts, has been a great program for people, helping them get through writing of abstracts, papers, getting through the publication process. In 2019, 7 faculty led new peer-to-peer session topics with over 100 faculty attending. So really, it's been great. Over 300 attendees since fall of 2017. Been to a couple of these things. There is always things that you can learn about how to give feedback. You can learn how to use PowerPoint. I will imagine somebody is going to be doing a peer-to-peer session on how to use Zoom, but there is a lot we all can learn from each other. As I mentioned, the strategic planning retreat is planned for September 29th. The goal will be to create a 2021 5-year plan. So this is something that we don't expect to have done this year, but hopefully we'll have it nailed by the middle of next year. Lead faculty will lay the groundwork. Everybody's going to be involved. We have 5 working groups that are going to be working in a matrix relationship with our typical mission. Those groups are going to focus on the framework of growth, quality and safety, diversity and disparity, and engagement within our typical lines of education, clinical care, research, and community relations. The people that have agreed to lead these lines, Patty Hubday, Brandon Nathan, Alicia Kunin-Batson, and Ashley Loomis, will be joined by the individuals who led these lines back in 2012 and 13. So we're really very excited about getting this up and going. Again, each work group will identify strengths, weaknesses, opportunities, and threats, the usual SWOT analysis, but then we'll actually have to go through a process of ranking our goals, ranking the strategies that we believe are most important to us going forward. In the area of faculty equity, diversity, and inclusion, Kathy Bendel has been very busy. The EDIC Council includes 15 faculty right now, and new members are always welcome. Kathy is our medical school representative to the University of Minnesota Climate Support Network. Each summer we offer Super Awards. This is not named after Rob Super. This is the Summer Pediatric Research Scholarships for minority and underrepresented medicine students. Excuse me. In summer of 2019, we had 5 awards that have generated 1 presentation for this year's press. The 2020 RFA just closed, so those awards will be coming out soon. There's an award for pediatric diversity. That award went to Dr. Kareem Sadak this year. Personal pronoun awareness campaign was launched in May of 2019. Over 1,000 stickers have been distributed. Again, this is important in that, you know, when we're dealing with transgender or other non-gender conforming patients, the pronouns we use are important. These kids are often sick. They have incredible stresses. We don't need to add to that by how we choose to refer to them. So we really need to take their direction on this. And Kathy and others have been important in helping to teach us that. There's a new epidemiology, diversity, and inclusion book club that's meeting quarterly now. Just recently, excuse me, our community here in, our community here on the West Bank is donating medical grade hijabs to our nurses and to our nurses and assistants in the hospital, allowing them to have actually clean hijabs to work in. This all just happened in the last few days. And something that will hopefully be done this year is the medical school will add a vice dean for diversity, equity, and inclusion. There were 3 finalists here. They all completed their interviews. I believe they're working through this in the dean's office now, but hopefully this individual will be in place by July of this year. Our clinical mission, just checking the time here. Our clinical mission is going very well. 2019, 2020, we were again ranked in 5 specialties in US News and World Report: cancer, GI, nephrology, pulmonary, and diabetes. So thank you to everybody who has worked to get this done. And again, ranking in a specialty is great, but it's really the work that happens everywhere else in the hospital: nursing, the other divisions, the safety, the care for kids with central lines, that helps make this happen. So these groups shift around a little bit every year, but it's actually a team effort. We continue to grow. This is from Ron Furnival. The annual ED visits have continued to go up. In 2019, we saw over 16,600 kids. We built the ED for 15,000 kids. It's gotten stressful, and we're looking for ways to expand that ED. Our serious safety event rate has been a very important metric to us on how we are doing in providing safe care. So this goes back to 2014, 2015. We hardly had any events, right? Not really. We just didn't report our events. As this came on, as the program began, people started to learn about it. They started to report safety events. So it rose. We started to intervene on those events, find ways to make the place more safe. It dropped, stayed static for a while, and then we may have gotten complacent. We may have had some bad luck. But either way, the serious safety event rate rose. It is now starting to turn down. Unfortunately, we don't have data past December right now, but we're hoping that this moves back to this low rate that we were used to in the past. These are events that we believe are preventable, and that's what's so important, that we find a way to make this hospital as safe as possible for the kids. Notable accomplishments this past year: we've implemented safety rounding on most of our units. We're seeing improvement in the serious safety event rate. We've had improvement in our surgical site infections, and thank you to everybody in pediatric surgery for working so hard on this. We've cleared the methicillin-resistant staph outbreak in the NICU. Doing this, we actually had to reduce our census in the NICU. We just had to create more space between the patients. We still have work to do in catheter-associated bloodstream infections. And a new area that's crept up has been pressure injuries. And this really is a challenging thing for us, because some of our kids coming out of the operating rooms are very, very delicate. And movement can trigger all sorts of problems. So we have to figure out a way to actually deal with the pressure injuries that we're seeing in some of these children. Our clinic volumes have gone up substantially. These are our arrived visits. Our arrived visits in 2018 were 51,800. We're at 56,700 for 2019. Overall, this is a 9.5% increase. You can see we've had some big increases in the Explorer Clinic, the Journey Clinic, very big increase in the Voyager Clinic where behavioral health was happening. Smaller increase in Discovery. Woodbury continued to grow at 17%. Ridges was growing. Maple Grove, we could grow Maple Grove. We just don't have enough doctors to put out there to grow Maple Grove. But hopefully some of these 44 new arrivals will help with that. But all in all, the clinic volumes have gone up. This obviously this all changed a few weeks ago with the orders to really move things to virtual visits, get rid of the regular follow-ups and change things around. This is work Brandon Nathan and Sarah Jane Schwarzenberg have done. It's just been incredible. Our clinic volumes dropped by over 50% in March. And this happened not just in pediatrics, but it happened across all of our clinics. Our RVU production cut itself in half as well. This created a very tough challenge for us. Dr. Nathan tells me that as of tomorrow, our clinic volume will be at 80% of normal. This is up from 30% just 1 week ago. We'll have to see if we can sustain this, but this is an incredible testament to the work in the clinics. Another amazing thing is that over 85% of our clinic visits have been converted into virtual or phone visits now. So this is equally remarkable. 25% were video visits at the end of last week. They're anticipating 75% at the end of this week and 100% next week. This is a way to reduce our backlog, really starting to think about how this will provide some new avenues for our practice of medicine. The important parts of this are, we're working to scrub the schedules, we're working to move the right people into the virtual visits. When you do the virtual visits, you can charge just like you would for a regular in-person visit. However, the important thing, because you're not going to have as complete a physical exam, is to document the medical complexity for those patients. The visits may be a little bit shorter, but you are going to be probably spending more prep time in advance of that visit and maybe spending some more follow-up time. So I think it's important to bill appropriately, but to make sure we're documenting especially the medical complexity of these kids. All right, new spaces. One of the most exciting things going on now is the creation of the Institute for Child and Adolescent Brain Health. This involves a lot of components of the university: child and adolescent psychiatry, rehab medicine, the Department of Pediatrics, child development, community integration programs, children's mental health research are all coming together to form a new program called the Institute for Child and Adolescent Brain Health. This is not what it's going to be called. Ultimately, we are working with a donor and have almost completed that, and this institute will be renamed hopefully within the next couple of months. But for right now, it stays as Institute for Child and Adolescent Brain Health, or ICAB. ICAB is going to be located in the Shriners Hospital on River Road. This is just down about a mile from the university campus on the East Bank. We're working very actively right now. The university has purchased this from the Shriners Hospital, and we are working in the design of these spaces. And this is just an idea of where we are right now. It's a two-story building. We're anticipating using the first floor for clinical care. It's our support staff, our offices. The second floor is going to be focused on brain health research, and that will include workers from the Department of Pediatrics, the Department of Psychiatry, College of Education and Human Development, the Center for Neurobehavioral Development. A lot will be going on there. This overnight stay thing got dropped, which is a good thing. We really don't need to get into the hotel business. That will make actually a little more space for community space as well as additional office space, which we clearly need. So this is up and running. We are hopefully looking at getting into this sometime in the latter half of 2021. West Bank space. So we are going to be moving some of our services on the West Bank. And the rationale is this. In 1986, the University of Minnesota Medical Center, what we called then Unit J, came online. This is the adult hospital, right? This is a huge step up from our old wards that we had been in Hart East in the Mayo Building. But when UMMC was built, it was built to be predominantly 2 patient rooms. This is not working very well. It's really working very badly right now with the COVID virus, but it doesn't work well even on its better days because rooms often beds have to be taken out of circulation for infection control, patient behavior, lots of other reasons, effectively dropping our capacity each time we do that. Now, most of the floors we are in the East Building, where our clinics are, where our pediatric offices are, pediatric surgery offices are on the West Bank, were functioning patient floors at one time. And the need for single rooms is paramount for the success for our organization. So these spaces are going to be reclaimed for patient rooms. This is challenging, and if we're in a big auditorium, I could hear the size of, oh my gosh. So we're gonna have to do this right. There's a lot of risk in this. But what is planned is relocation of the Journey and Explorer clinics. So these are our clinics on the 9th and the 12th floor of the East Building to the Riverside Professional Building. We're estimating that we will need somewhere between 2 and 3 floors of that building to do this. And the early work is ongoing right now. We're meeting for about an hour and a half every week with the architects as we try and make sure we not only cover what we need to, but we also have room for growth. And that's a challenge. This is just where we're going. This is a map of the campus. There's Riverside Avenue. There's the Mississippi River. This is the East Building. This is the South Tower, what we call the Children's Hospital. These will be moving to the Riverside Professional Building. And that is the building that you see if you stand at the front door to the emergency department and look across the street. At the same time, we're working on office relocations. We're going to need to relocate our space on the 5th and 6th floor of the East Building, as well as our people that were on the 2nd floor of the 2512 building. So all that is planned for transition to patient rooms. We are also going to need to transition our staff who are in the staff and faculty who are in the Riverside Professional Building, because we just said we're going to take that space and turn that into clinic space. So this is a lot of moving pieces at one time. The plan as of today is that our staff, faculty and staff that are in the Riverside Professional Building, as well as those faculty and staff that are in the East Building, will be relocated to the St. Catherine University campus. This is what you see if you just go down 25th Avenue past the hospital and these buildings on the right. There's a tall concrete building that's called the Education Building, a smaller U-shaped building that's connected to that education building that's a little closer to the river called the main building. We are working through this right now, though this is not moving quite as fast as the work around the clinic space. Research, we've had an incredible research year, and I want to acknowledge everybody's hard work here. In 2019, 111 new grants or competitive renewals, 60 unique PIs from 16 different divisions. That's just fantastic for the spreading out the breadth of what we're doing, and 18 new or renewed federal awards. And the federal rewards, the RO1s, the CDC grants, Department of Justice grants are shown here. So really congratulations to everybody who has been a part of this. It's, excuse me, make that stop. It's been absolutely a huge effort, and want to congratulate everybody that's been involved. Last year, we had a good year in terms of our NIH support with a little over $26 million. Again, that placed us at number 8 in the nation for departments of pediatrics. Here is where we sit. Here are our neighbors. We came in ahead of Hopkins, Wisconsin, Madison, Stanford, UCLA, number of very good places. We certainly have some ways to go to challenge Duke and Denver up there. This interestingly switched this year, and the only way it switched for that much money is I think somebody that was holding one of these national cooperative group grants must have moved from Colorado to Denver or Colorado to Duke. So, but this is a great accomplishment, and thank you to everybody involved in this, whether you're the PI in the lab, whether you're the staff supporting that PI, the technician, the student working in there in the summer. This is really great to see. So as we wrap this up, I want to talk a little bit about staying on mission. Our departmental mission is here, and it's not that remarkable. It's not that different than others, but I believe if we stay to it and we keep after it, we really make a difference. So it's to generate new knowledge through research, apply the knowledge to highest quality health care for prevention and treatment of illness in children, and provide the best possible education of the next generation of medical students, physicians, and other health professionals in childhood disease prevention, treatment, research, and advocacy. This is a lot to do, and it happens because of what everybody listening to this talk does. So a couple opportunities here. First is a new grant application that is going to come out. Mark Slice will know, but it was just agreed to yesterday that Children's of Minnesota, the Clinical Translational Science Institute, led by Bruce Blazer, and the Department of Pediatrics, are each going to contribute $30,000 to this RFA to look at the impact of the COVID virus infections on kids. The proposals should represent novel scientific studies stemming from the COVID-19, particularly interested in learning more about family fragility and disruption, knowledge gaps about COVID-19 in children, and how to optimize pediatric care in this setting. So again, more to come on this. We've tentatively agreed on 9 awards, up to $10,000 each, and the RFA should be coming out here within the next couple of days. If you have questions, please just shoot Dr. Schleiss an email. He'll be happy to help with this. We're very excited to be able to do this together in town. The other thing we do is we change the practice of medicine. And I'd like to talk just for a minute or two now about one of our faculty, and this is Dr. Jen McVean, who's an assistant professor in pediatric endocrinology. Jen joined us a few years ago. She'd been a practicing pediatric endocrinologist in the community for a number of years. Dr. McVean is an expert in the hybrid closed loop therapy for type 1 diabetes. And what does that mean? So this is an innovation in care. Dramatically improves the ability to achieve tight glucose control, and it does it through the use of a sensor that is continually monitoring glucose and transmitting that data to a pump, which uses algorithms to adjust the background insulin to a target glucose of 120. Pump can decrease insulin delivery as glucose decreases and increase insulin as glucose increases, again, to help buffer the highs and the lows. And it's a system that's being adopted around the world. But it's complex, and there's a lot of work and expertise that's necessary to understand how to do this. So Dr. McVean was an early adopter of this technology in her practice and now has emerged as an international expert. This is one of her children. This is not one of her patients. Jen's been invited across the country and really around the world to help teach other healthcare providers how to do this. And as she's used this technology, she's observed when patients with new onset diabetes start this right away, they seem to stay in that honeymoon longer, where they may need very little insulin to keep their diabetes under control. So Dr. McVean hypothesized that the tight control by the hybrid closed loop therapy may be allowing the beta cells to rest, possibly making them more resistant to autoimmune destruction. She enlisted Dr. Moran to help write a grant for a randomized clinical trial, and to that end was just funded by the Juvenile Diabetes Research Foundation to the tune of $5.6 million. So this is now going to be a multi-center trial that will involve us, Yale, Indiana, Children's Mercy in Kansas City, Stanford, and the University of Colorado. Again, this is a type of not opportunistic, but keeping your eyes open research that allows us to ask questions, allows us to take the observations we make in clinic and go backwards to research in much the same way we take the observations we find in the lab and move forward in research. So all these things are complementary to one another, and I really want to congratulate Dr. McVean, Dr. Moran, and this entire group on pulling this together. So that's it. We have a little bit of time of questions. This is a picture my wife took when we were scuba diving a few years ago. This is a turtle getting cleaned by these little tangfish. And again, as a reminder for everybody that you don't go it alone, sometimes get help from your friends. This has been a challenging time, and I sincerely appreciate the efforts that so many people have made to keep things going in a positive direction and for our academics, our education, and our clinical care. So with that, thank you, and we'll be very glad to take any questions. And now I'll have to figure out how to do that. So, okay, let's see. Emily, how do you want to handle questions?
I think probably if people want to just post them in the chat, that may be the easiest.
Okay.
What is it? Record Grand Rounds attendance of 258, our highest ever.
Oh boy. Well, thank you. That's our staff coming. So really, thank you all for listening in. Questions or comments on anything? So Dr. Whitley sent me a note. We are looking at, I did miss at least one person, I'm sure, in this, but we're looking to add Janine Jarnes, PhD into our programs here this year. Gotta keep it all straight. So yes, Janine is a PhD working in lysosomal storage diseases. Okay, well, okay. Capacity. What are the plans for expanding PICU capacity? Thank you. I should have talked about this in the presentation. Clearly need to increase our beds. Before this COVID thing happened, we were in a constant state of bed management. So that are going on right now. One is there is an expansion going on of the NICU on the 11th floor. So we currently have the east wing of the 11th floor. The west wing has been basically was the Ebola containment thing. Maybe I'm wrong on that, but the west side had not been used. We're opening up the west side, and that building going on now. And I believe we'll add about another 14 beds to our NICU, taking our capacity somewhere up into the mid-70s. So that's hugely important. Our other space crunches come in the ICU, both the pediatric ICU and the CV ICU. To address that, there are a couple things that are happening. Number one is we've secured space in the East building, the 8th floor, for pediatric patients. Now, that whole thing got blown up with the surge plans right now, but as this thing starts to hopefully wind down and forward, we'll have the ability to put somewhere around 10 or 11 patients there. At the same time we're doing that, we're looking at taking some of the beds on the 6th floor and using those beds for almost like an intermediate care step-down unit from the ICU. So children that may need to be correctly ventilated, a new diabetic getting started on insulin, I've got a new leukemic with a 200,000 white count that needs close management and maybe plasmapheresis. A lot of that stuff could be done at a high care area, but not necessarily an intensive care unit. So that will functionally add 6 beds to our ICU at that time. So that's where we're hoping to take this right away. So future plans for expanding research space. This is a big deal for the medical school. You know, Jacob is really making a push to expand and grow the research of the medical school. He wants the medical school back into the top 20. It moved up from, I think, number 30 to number 27 this year. So the trajectory is nice, but we're only going to do that by creating new space or repurposing old space. And there is a lot of work going on that. There's not any new buildings planned that I know of, but there is a much harder look at the people that are occupying space and trying to understand whether, well, it's my lab, I've had it since 1982, I get to keep it, or it's my lab and this is a productive lab, it's doing work. So lab space that is not being used productively is going to be brought back into the organization and likely reallocated. But there is also a major move to refurbish some of the space that has just become antiquated. That's kind of a lame answer, and I know it. It's just really a challenge right now to find laboratory space. Have we considered moving moms and babies to the East building, from the back to the East building and using the South Tower? Yes, we have definitely talked about that multiple times. That is probably not going to change right now. The work that was done to build out that 7th floor really was to create a postpartum environment that was community competitive, and we don't think we can do that the East building space. So it is a challenge. It makes sense. But we probably cannot do that right now. We will, with the advent of the reconfiguration of the East building, if, you know, after the Journey Clinic would leave, the Explorer Clinic would leave, and then we're looking at building out really new, refurbishing those wards. We're hopefully will be involved in anywhere from 12 to 20 beds in that space, which would help a whole lot. We were starting to talk about how we would use that. Would this be an adolescent young adult space? Would it be surgical space? Would it be one of our divisions that would take over that primary space? So we're really looking at how we can take advantage of what's going to happen over the next few years. And then a very good question. What would the Bethesda COVID campus play in our future? I don't know. It was really built out, and I've never been in the building. That was really built out to be space for the patients with COVID infection, with coronavirus infections. It's got about 90 beds in it. It has a 36-bed ICU, I believe. But I am not sure what the long-term plans are for it. that's a great question that will need to be considered, and that's one of the that beyond the COVID challenge. So thank you. So it is 8:31 now, and again, I'm happy to take questions. Just shoot me an email. I will be on the wards tomorrow for a week, attending on the HEMONC service. So we'll hope to see people around campus. It'll be actually nice to see people, broaden my social circle a little bit beyond me and my wife in our house. Thank you all for attending, and again, thank you everybody for what you do. And with that, Emily, I close this off. Emily, do you need to shut down?